Okay, so you will see, for example, the GOS. Okay, so the way that this is developed is that the OTs certainly are contributing to classifying the level from no impairment to marked impairment. And the way that they're doing that is by taking those ADL areas and plugging them into the description of the category. Fully independent or independent with the device, is partially dependent, fully dependent, using the language of those categories. And then plugging them in so that when the, in this case, neuropsychologist, this is GOS, is able to look at these, can tease out the relevant areas, the left-hand pain that shouldn't belong, maybe depression that shouldn't belong because we've decided it's really grounded more in the physical limitations. And then come up with an evidence-based opinion in terms of the classification, the diagnosis, and whether or not CAT is met. And the same thing applies to the mental behavioral. You'll notice there's a different, we're using the language of the classification, the mild to marked. No impairment, some useful function, significantly impedes. So you're not overall giving a classification, but you're sorting. You're giving us the groundwork of where the person generally is and setting things up nicely for the diagnostician, who's ultimately responsible for making the determination in terms of the CAT classification and whether the person meets CAT or not.